1 in 3 people will have some kind of cancer diagnosed during their lifetime. The diagnosis of any life-threatening illness is devastating, of course, not just for the person with the illness, but for their family and friends too. Help is available, however, from many sources, including the hospice movement, founded by nuns a century ago. We would like to show you the work of one hospice, Cotswold Care, in Minchinhampton, near Stroud in Gloucestershire. Many people come to our open days to see Cotswold Care in action. Once you also have had a chance to see what we do for people with life-threatening illnesses, we hope that you may be able to support us, either with a donation of money or by giving us some of your time. Volunteer helpers are always urgently needed. Cotswold Care is a day hospice. Every weekday, around 15 people come here, 75 people every week, and a further 25 people are visited in their homes by our volunteers. So we help a total of 100 people every week throughout the year. None of them is asked to pay anything at all for the time they spend here or for the services we offer them. While they're here at the hospice, they are our guests. Since the hospice was opened in 1990, Cotswold Care has grown to become a place where people with life-threatening illnesses find the highest standards of therapy, support, understanding, and real friendship.
Many people who visit the hospice for the first time talk about the warm, relaxed, informal feeling of being here. The nurses don't wear uniforms. Everything is very much geared to the feel of a home from home, and we work very hard at that. We like guests to come in here and feel very relaxed and to choose what they do. There's no organisation of how they spend their day. It's very much a day for them, and they can take as little or as much of the services that we have on offer each time they come, depending how they feel. I think it's been called a place where people come to die, and of course that absolutely isn't the case. We are a place of hope, and we're a place where people come to learn to cope after they have had the news that they have a life-threatening illness.
When I first came, I was a mere shadow of what I am. Actually, I could barely walk, I could barely sit. In fact, I could sit, but it was too painful. I couldn't do anything for myself. I weighed 10 stone, having weighed 14 stone at the beginning of my illness. I was down to 10 stone. I couldn't eat, I couldn't do anything. I wouldn't have come at all had the persuasive nurse not worked on me, had me parcelled up and bundled up here in no time. And I can honestly say from that day, I changed my attitude altogether. The feeling of people caring and bothering about you, and sort of pleasant atmosphere of the place, really. Well, quite literally made me feel it was worthwhile living on.
Guests come to Cotswold Care from all over South Gloucestershire. Each guest is collected from home by a volunteer and driven to the hospice.
We have volunteer gardeners, volunteer cooks, volunteer receptionists who change at midday, so we have 2 receptionists a day, carers, drivers, and in a lot of cases a driver and carer. So they bring in the guest in the morning, stay for the day, and help with other guests as well. They're just wonderful. We couldn't manage without the volunteers at the hospice. And next to the guest, they are the most important people here at the hospice.
Once the guest has arrived, a wide range of services is available, including various kinds of therapy, offered not as a cure, but to enhance the quality of the guest's life. For example, guests have the chance to use one of the hospice's superbly equipped spa baths. For more disabled guests, this may be their only chance each week to have a bath. We also offer counselling, reflexology, aromatherapy, and remedial massage.
touch is very important. It's certainly a means of communicating, I care for you, I accept you for who you are. Many patients who have experienced disfiguring surgery or the traumas of having radiotherapy and chemotherapy and all the symptoms and side effects that occur with that, they feel unlovable, untouchable.
Sit you back.
Through touch, there is a sense of relaxation, of getting rid of the muscle tension, but also the touch is the most powerful way of communicating, I care.
Counselling support is central to the service we offer our guests. There's always time to listen and to talk, with the staff and with other guests, in groups or one-to-one in private.
Quite often people want to look back over their lives and talk about the good times and the bad times, make some sense out of what their lives have meant to them.
Well, we spent the first 22 years of our life in the army, going from Germany to England, back to Germany again. And then my husband was posted for his last 3 years to Cirencester. We'd only been here about 8 months, and I was diagnosed as having cancer, which was quite frightening because I was in a place where I didn't know anyone. Well, when my doctor first suggested I came here, I wasn't quite sure about it, but I thought, well, I'm the sort of person, I'll try anything once. And I came and I was really surprised. Everyone was so kind and understanding, and I suddenly found I'd got friends. This place, to me, is part of my family. I find a lot of benefit from being here because I've got a long-term cancer, and I need support. And this in the hospice gives it to me. It's a good place to come to.
After a delicious restaurant-quality lunch, guests may choose to rest and chat with staff and other guests. Other therapies and services available include hairdressing, chiropody, and the facilities of the art room.
Well, I wasn't very interested in art, although no one tried to force me to do it. They brought me into the art room. And I think it was about the second or third time I was here that I had a go at painting with rather disastrous results, as you can see on the wall. But gradually, the sort of sympathetic approach and the feeling about the place which made me feel as though I ought to be doing something, gradually I improved, and I think I've improved a little because this is my latest effort. And in between I've done quite a few of that standard, and some have been sold to help the hospice.
I love painting. All my sons have got paintings in their houses from me, and it's something that when perhaps I'm not here, it'll be something that they've got that they can say, oh, Mum painted that.
No, it really gave her a lift, or she was in on Monday, didn't it? I think it was the fact that you'd gone and got it and brought it back and given it to her and just...
At Cotswold Care, we work very closely with other healthcare professionals in the area.
One of my main roles is to liaise with the community services, and they include the hospitals in Cheltenham and Gloucester and the Macmillan team, and also the health centres with their GPs, practice nurses, and of course the community nurses. So really we're encompassing as much of the community as we can, and this I think is really quite an important role since we started our Cotswold Care at Home services, because really as a sitting and befriending service we're reaching out to people who may not have all the help that can be provided by the statutory services. The hospitals have a service to offer patients in an acute phase, but after that they are sent back to their homes to be cared for in the community, and this is where we can pick up the link and add that added extra that you can't always find in the NHS.
A life-threatening illness doesn't happen to to the person with the disease. It happens to the whole family. It's very much a knock-on effect. It's not just the patient, it's the whole family. So the hospice very much feels it has an important role in helping the family, supporting the family through it, and that is through the sitting service. It's through the respite given to someone by having the guest come here, that their loved one come here as a guest for 1 day a week, and also the knowledge that following death, that we don't desert the family, that we're there for them in whatever way that they may need us. We have trained bereavement visitors who go out and offer that support. We say right from the beginning, we're here for the whole family.
Another central part of the work at Cotswold Care Hospice is our growing educational service. This is a service we offer to local healthcare professionals in Gloucester, Cheltenham, Dursley and Cirencester, as well as from places outside the county. Doctors and hospitals recognise our high standard of care and expertise and send their staff to us for training in the care of patients with life-threatening illnesses. Our education service offers courses to local healthcare professionals and our own volunteers. We offer a wide range of courses, including listening skills, communication skills, bereavement issues, and updates on cancer treatment. We also plan to give community nurses a programme of training on the role of the day hospice in cancer treatment.
At Cotswold Care, we're sensitive to the need for change. Not change for change's sake, but to satisfy the ever-increasing needs of our guests. Our long-term plans include building projects, additions to the services we already offer, and a programme of training and education for staff and volunteers, which will increase still further the quality of the care we provide. Perhaps the most valuable quality our guests find at Cotswold Care is the friendly, understanding atmosphere here. Nara Allen, back at work now after a gruelling struggle against cancer, describes what Cotswold Care means to her.
It helped me to relax and to get back to normal. And it slowed me down, made me stop and look at things. And it was such a nice feeling just to be able to think, oh, there's no treatment, there's no doctors, there's no one with a needle waiting to stick it in your arm. You can talk about your illness if you want to talk about it, because there is always somebody to listen to, be it another guest or a member of staff. And if you don't want to talk about it, then nobody pushes you to talk about it. We are very positive here, because it pays to be. Speaking personally, if I hadn't been so positive, then I know damn well I wouldn't have got through everything I have got through. We've got a lot to be unhappy about, I suppose, some of the illnesses that people have got here. But it doesn't have to take up your whole life, which it can do. It takes up a large proportion of it when you're going through it, but there is something else besides. And it isn't all doom and gloom. And yes, we cry when it's time to cry, when people die. And then we sit down and we all cry together, because it is sad, and that's the reality of it. People do die, but also the reality of it, people do survive, like myself. I've grown enormously through everything that has been done here for me. I'm a lot more confident, a lot more outgoing, a lot more positive. Cancer can squash your life straight down, and it's helped me grow and grow a lot bigger.
2 days before the death of one of the guests, he said to me, the one thing Cotswold Care has given me is the ability to hug and be hugged and to know that there was no payoff, and it's improved the quality of my life. And yes, it sounds so simple and maybe to many people unimportant, but to him it was a statement he needed to make. And in sharing that with me, he also said, I feel as if I will die peacefully, and I'm ready to die peacefully. And in fact, he did.
Now that you've seen the work we do, I do hope you'll be able to help us. We need lots more people to help us keep the funds coming into Cotswold Care. Perhaps you could make cakes for us, help us sell Christmas cards or run a stall at a bazaar. Could you rattle a collecting tin? There are so many things that you could do for us, and they're so important. Just ring us at the hospice. Some people covenant money to us on an annual basis, and it really helps. It doesn't have to be a large amount. Or maybe you'd like to give a lump sum. One of the ways you really could help is to remember us in your will. Thank you.
Well, I'm looking forward to my day again.
Good.
Get pampered,